All right, welcome back to Patient Win Insider. I'm Nick Moen. Today I'm joined by Dr. Darlenn Ayan, founder of a long-standing private practice in Naples, Florida. Dr. Ayan has been practicing dentistry for over 3 decades and has owned multiple practices, recently completed a full relocation to a brand new technology forward-facing facility, and she's known for comprehensive aesthetic-driven care, deep investment in technology, and a strong commitment to mentorship and education. So today we're diving into how dentistry has evolved, what it takes to stay at the top of your game after decades in practice, and how technology and mentorship shape predictable outcomes. So let's get into it. Thanks for coming on, Dr. Ayan.
It's my pleasure. Thanks for having me.
So just a little background. You've been in practice for 30 years.
Yeah, just a little over 30 years.
Yeah, that's incredible. Well, so what's the most blatant thing that's changed since day one until now?
Technology.
Yeah.
Absolutely technology. Yeah.
So tell me a little bit about the technology that you were working with when you first started, and what's your most exciting piece of technology that you're using now?
So I had a previous practice over on the East Coast, and we really had no technology there. It was just basic dental practice from the 80s, 90s, x-ray processor unit where you had to go and wait 4 or 5 minutes for an x-ray to even come out. So I built this practice in Naples 24 years ago, and I thought I was really advanced. I mean, I was high tech. I had a digital sensor. So we had digital x-rays. We got rid of paper charts. So now we had a practice management software that was all digital. So we didn't have paper files. So 24 years ago, that was really advanced.
Yeah.
Fast forward nowadays, that's basic. I mean, everybody has digital sensors. So now our technology is completely different. It's the way we take impressions on patients. We no longer take all this gooey material that we used to put in people's mouths. Those are all done by scanners. So we have scanners for clear aligners, something like Invisalign, or we have another scanner for crown and bridge. We have all of our photos is digital. We mail out our crowns, mail out our temporaries, so they have just this great precise fit. We have 3D printers. Yeah, completely different. Nothing I even would have dreamt about 30 years ago.
Yeah. Well, it's so exciting, and obviously that's increased patient care exponentially, right?
Absolutely. Absolutely. The care is completely different. Not to say that lab technicians weren't delivering great care before. We had great fitting crowns, but now we can actually control where the margins are on a crown as opposed to having my lab tech try to figure out exactly where my margin was. I know where I prepped my tooth, so I know where my margin goes. I know where I need to put that crown to really seal it well. And so the longevity on a crown, I think, is much better. Patients don't have to come back. So if it's 1 or 2 teeth, we can place a crown in one visit. So it saves them time. It saves them the anxiety of having a temporary that might come out during a lunch or dinner that they may be at. So yeah, no, that's definitely really helped.
Yeah, well, and tracking the KPIs and financials behind the business obviously is a huge driver for staying in business for 30 years, but you've owned multiple practices now, right?
I have, yeah. But still always with the same philosophy. And I think that's what's always helped me grow. My patient philosophy has always been relationship based. I feel like I'm still in it, even though a lot of my colleagues are retiring nowadays. But it's because I still really enjoy what I do and I still want to treat a patient the way I would want to be treated. And that's what fuels me. I treat my patients the way I would want to be treated. And I think they see that. And it helps us really enjoy what we're doing.
Yeah. And one big move that you've made this year is the new location, right?
Yeah.
What
Yeah.
did that look like? Like yeah, why did you have to move, and what did you have to take into consideration, moving into a
Mhm.
new spot?
Couple of things. First of all, when I first built my new location here in Naples 24 years ago, I had a small location and I thought this is all I'm ever going to need. It's going to be more of a type of a boutique kind of practice because I understand I can't be a dentist for everybody. There are patients who really rely on certain insurance-based practices and that's not what I was going to be offering. I was more about offering hopefully something that was going to be comprehensive care that would last a long time that they knew I would be there for them. And that's not for everybody. So I built a small office, but I outgrew my space. But not only did I outgrow my space, my landlord also decided that they may be tearing down the building that I was in for so many years. So I had to move because I was either going to retire and hang it up and sell that little location. And good luck to whoever was coming in there, or just move and continue what I'm doing on a bigger scale. So this is 3 times the size, but we were able to bring over all of the technology that we had at the other office. At the other office, we every time we had technology, we're like, okay, let's find a corner. We're going to make it work.
Yeah.
So my break room was taken over by a 3D printer. My office had other technologies. The scanners were put in whatever corners we could find. So now we have the place to really not just showcase our technology, but really have it where we need it. We have a space and a home for every piece of technology. So it's been nice, and my team really loves it. I love it, and our patients are loving it too.
Yeah, how did the patients react to the new space after moving in? What was the
Yeah. Well, at first, I think it was going to be a little hard for them because of that location. It was a very accessible location for walkers and people who would ride their bike, but it's only a mile and a quarter away. And so that's what I keep telling everybody. It's only a mile and a quarter away. So we've offered to pick up patients if they're really just only walkers and they have no other form of transportation. But when they come in, they see the difference and they're like, now I know why you built this office. So they can see the improvements.
Yeah. And so yeah, so now you've got a full lab, right? That's
Right.
separate. You're not stuffing stuff in the break room.
Right.
How did you, I mean, you were an early adopter of some of the technology. Like, how did you learn about the technology and how did you say, hey, look, I'm making this investment?
Yeah. Well, and that's the thing. So it is a huge investment, but it's not just a huge investment on the technology, which is part of it, huge investment on education. And so you have to get educated and you have to stay educated. So you can learn the basics, but that's just not going to teach you what you really need to know. So you have to continually keep yourself educated. So I'm a big believer in educating yourself and really trying to master what you're doing.
Yeah. And were you working with like Henry Schein or Patterson or directly with the manufacturers or who is doing the education for the most part?
Yeah, so Patterson is my dealer and they help me set up my practice. But no, there's an organization called CDocs and they are amazing. If you're going to be learning anything to do with CEREC, which is what we use to mill our crowns and design our crowns, that's the way to go. So
Yeah.
I've been invited to be on visiting faculty with CDocs, and I'm honored to be a part of that group. And it's amazing. We have discussion boards where we can post our questions and we know who we're getting our answers from. So it's not just a Facebook post. We can go there and learn from our colleagues. We can go and mentor and see how much we're learning, but also keep up on what is out there, all the new technology that's out there, and how to implement things. So that's been huge. Spear is amazing also, just to make sure that you're at the top of your game with dentistry in general. And there's so many more courses out there. I mean, there's so many things that you can go out there and learn. But you can't just think that you're going to buy this piece of technology, get that initial training, and then that's it.
Right.
No, there was actually this one gentleman that I met at one of the CDoc courses, and he was there, and he said, "Oh, well, I'm a MacGyver. I can figure this all out. I'm only here because my owner dentist wanted me to come." So I spoke to him a couple of days later. I said, "So how is it going?" He goes, "Oh, I've learned so much." Of course you have.
Yeah.
Yeah.
And do you have a lab tech then that you work with?
No, I've trained my assistants. So I
Wow.
have 3 assistants. I took one of them actually up to one of the courses and I'm constantly training them. So education is for myself and my assistants and my associate. And luckily I have a really good team that's committed to making this work. So that's huge. They weren't sure about it in the beginning, but I think the more they learned, they drank the Kool-Aid and they have the bug too now. So so they're inspired by what we're doing and they're motivated.
Yeah. So you're driving the why for them, right? And you're giving, but now they're
Mhm.
saying, "Hey, look, this tool is actually making my job easier, and
Absolutely.
and the patients are happier when they leave." I mean, you're able to do same day crowns.
Right, right. And they're proud of what we're doing too, because they see that. So when my team actually notices what we're doing and they see the benefit, they can speak to the patients from their heart and really tell them this is really why we're doing this and how it benefits you.
Yeah. So for doctors that are listening, that maybe are overwhelmed by implementing some of this new technology, what's your rubric? Like, how do you decide what's worth adopting versus waiting on?
Depends on what you're interested in. And I would say don't even try to get all of the technology all at the same time. But for instance, I like placing implants. And one of the things that I feel is vital to placing implants is having a CBCT, a cone beam CAT scan. And a lot of practices don't have that. But if you get your cone beam and you get a 3D printer, there is an amazing workflow, which makes it so easy, so predictable, and so fun to place implants. And so I feel like it's beneficial not only for your patients, but for yourself too, because that confidence level is amazing when you know what you're doing and you can see things in a 3D format. You can't do that without this technology. So if you like placing implants, definitely adopt those pieces of technology. If you like doing crown and bridge, then get a mill. And you can start by getting a scanner, maybe just starting off with the scanning and work with the lab and then get your mill. But then the 3D printer will come. So there's a lot of things that you can do, but try to find what you're interested in and adopt that technology first. Get really good at it and then see what else maybe would be beneficial.
Yeah. So a lot of aesthetic dentistry, but when we spoke earlier, you said it is really about comprehensive care, right?
Absolutely.
How do you balance, long-term function with beauty, with the aesthetics of it?
Yeah, no, I think that's huge. That's really important. And I was lucky enough in my early part of my career, even before I really came into this digital world, to really get a really good occlusion background. And I attribute that to Dawson and Pankey. So the Dawson Academy, the Pankey Institute, those were huge. They really helped set up the fundamentals on what occlusion was like. And so form following function. I know a lot of us, get exposed to some of these little terms, but you really have to figure out how to make things work and not just make them look nice.
Yeah. So all of a sudden you're folding in orthodontics into the functional practice of orthodontics into the aesthetics and the beauty of a smile.
Yeah. So orthodontics is part of it, but just making sure that you have proper occlusion. I think that's important. And a lot of times it does require orthodontics, but not necessarily. So yeah, you just have to have good occlusal principles to follow, and that's really important. So yeah, it's not just implementing digital technology, but there's again, education is so important. So, like I said, early on in my career, I knew how important it was to just learn so much more than what you learned in dental school. So
Yeah.
I went out there and I educated myself at as much as I could. So I got my master's with the Academy of General Dentistry after getting my fellowship. I just felt it was really important. I feel like education is paramount.
Yeah. So how do you, I mean, what would you recommend for somebody to stay in the loop with continuing education?
Again, follow what it is that you're interested in and educate yourself as much as possible. Nowadays, we didn't have this when I first got out, but nowadays there's so many virtual courses. So many of them are free too. So there's no excuse. So if
Yeah.
you're interested in something, go out there, find what you really want to do. And then there are local courses as well. Study clubs are really important sometimes too. If you can find a good study club that will align with what you want to do, that's great. And then there are those other courses where you'd have to travel to. I think that's essential.
Yeah. Well, balancing, running a business at the same time. I mean, is there like a special sauce for staying, up to date with technology and education and also like making sure that, the company culture is good and everything's running smooth on the business side?
Yeah, no, I think that's important. And I think that was one of the things that I adopted from Pankey Institute. They really have a nice, strong philosophy on balancing your life. They reference the Hippocrates cross of life and having everything balanced. You want to have your work and your play balanced with your spiritual, and you've got to have a good balance in your life. And so I think that's important. And I've been able to do that thankfully. So my kids are all grown already, but I was very involved with their school. And as a business owner, it was nice to be able to say, block off from 12 to 2. My kids have something at school. I'm running over, but then I'll be right back.
Yeah.
So yeah, especially being a female dentist, I wanted to make sure that yes, I was a business owner, but I was also mom.
Yeah, absolutely. Yeah, to balance everything. Well, and then you're balancing mentorship as well, right? And
Absolutely.
you're using that. I mean, obviously, teaching is integral, but do you feel like you're learning anything through mentoring as well?
Yeah, no, absolutely. Because, like I said, technology too, it changes. So when you go back, you're learning from your colleagues, or there might be something that maybe you didn't get that one time out of the 20 things. You're like, oh, wow, that's right. That's what we're supposed to do. The other thing is, I do have an associate now who she's been out of school now for about 10 years. And so she's not a new graduate. But at her other practice, it was more of a clinic kind of atmosphere. So she was really just doing resins and crowns, and that was it. So she came on, and I've known her for several years, and she wanted more. And so now that she's been working with me, it's been a pleasure actually mentoring her. That's been great. And we really collaborate, and I love that part of it. We're collaborating on cases, and I'll show her something that I'll be doing. And it just gets me thinking, okay, well, let me see. Well, is there something maybe a little different that I can do here? Because now I'm having that discussion with somebody.
Yeah.
So
Yeah.
yeah, yeah.
So you're not isolated. I mean, I hear that all the time that it can be a really isolating
Right.
experience running a practice and just being a dentist, but the mentorship aspect. 7 years, she's been with you for 7 years.
No, she hasn't. No, she was at another practice for 7 years. She
Okay,
actually just joined me in July full time.
fun.
So yeah, yeah, no, and it's been great. Yeah, absolutely.
So then that's something to be excited about, like having that mentorship
Yeah,
and education
yeah.
aspect. What else is keeping you excited about doing dentistry?
You know, several of my colleagues have been retiring, like pretty much a lot of people my age now have been retiring. And I just don't see myself retired. And I just think, okay, I'm getting paid for something that I like doing. To me, it's like it's a fun challenge still. So why would I even consider doing this? Retiring. I didn't stay at home when my kids were young, so there's no reason for me to stay at home now. And I can still balance things. So if I wanted to, I went to a ladies' brunch yesterday, so I took half the day off. And that was okay. That's part of my balance. But I still really enjoy coming to the office.
Yeah, I
So
love
as
that.
long as I can do it, I hope
Right.
to do this for several more years. Yeah. No, I
Well,
hope
yeah, what
so.
does
I
the
hope I
next
can.
chapter look like? Like, I mean, knowing that all your colleagues are starting to retiring or potentially selling their practice. Like, at this point, are you refining? Are you growing, or just focusing on balancing? Like, how do you prepare for that? Now that you have the time and everything's running so smooth.
Well, I'm still trying to grow the practice now, especially too, because I do have my associate full time. And so, being a solo practitioner for 24 years, I had a certain business. And so now bringing in an associate, I do have to grow the practice, but I'm enjoying that aspect too.
Yeah. And is that, I mean, I guess success may look like being able to go to brunch with your friends, during the workday, right?
Absolutely.
Did
Yeah, no,
you
absolutely.
imagine that was like 20 years ago? What was your definition of success, and how has that changed to where you are now?
No, so absolutely. Now I have that freedom to be able to do that. So I feel like I'm successful because I have that freedom. I'm able to choose how I'm going to work and what days I'm going to work. So even though I'm still full time, I have that flexibility. So previous to this, years ago, when I was growing the practice and I would choose to do certain things with my kids, I was lucky enough that my kids' school was really only a few blocks away from my practice. And so I was room mom, I was involved, but it was a sacrifice. Then it was a sacrifice where now it's really more of like I'm choosing to do this, and I know the practice is going running well, and I have my associate too that can help me with that. So yeah, it's a nice benefit.
Yeah. So how do people connect with you if they want to learn more, or if they're in Naples? Like, how do people find you?
Really? We've grown our practice word of mouth, and everybody keeps saying, well, gosh, you built this beautiful new practice. You've got to get on social media. And I'm still so old school. I haven't really grasped that aspect of my marketing. I've never really even done I've never marketed. So now we're trying to. I'm learning how to do that. A little bit of my free time now is being spent on business systems. So I'm trying to create a little bit more organization within our business. So, and marketing is part of that. So now we are trying to get our website going. We have a new website that we're working on, social media. But for the most part, it's calling my office.
Cool. Amazing. Well, this has been an incredible conversation. I really appreciate you coming on, Dr. Ian,
Hey,
and
Nick. Yeah.
sharing your perspective and experience. And it's so nice to have a guest on that's just thriving, after decades in the industry and still pushing the boundaries of technology and really concerned about patient care.
That's my pleasure.
Yeah. So thanks for coming on. Until next time.
Okay. All right. Thank you.